It's a new year, and whether you recently moved or maybe you adopted a new pet, if you find yourself looking for whatever reason for a new veterinarian in 2017, there are a few things I think you should keep in mind. One of those is accreditation by the American Animal Hospital Association, or AAHA for short. Dr. Mike Cavanaugh, AAHA CEO, explains that accreditation is voluntary for animal hospitals.
Accreditation is a voluntary process, and clients, pet owners assume that every animal hospital is accredited by some entity because they know that's how it is on the human side. And if a human hospital is not accredited by JCO, they can't participate in programs like Medicare and Medicaid and that. And so they all are accredited. When they find out that accreditation is a voluntary process, it's a really eye-opening experience for them.
I know, it was eye-opening for me. Now, in most states, unless a complaint is received, animal hospitals are not subject to any outside evaluations to ensure that they're safe and clean. That's one reason why I've been taking my pets to an AAHA accredited animal hospital for as long as I can remember.
Since that's a voluntary process, it's an outward sign that there's a practice that's trying to be the best they can, and no one's forcing them to do that. So once people understand that it's a voluntary process, most of the time they become AAHA advocates almost instantaneously, and they'll start looking for the logo as a means to identify a practice that's really going above and beyond what's required by the law.
So how does an animal hospital become AAHA accredited? Dr. Cavanaugh says it's based on regular evaluations and a comprehensive list of more than 900 standards of excellence.
And we have a total of over 940 standards in 18 different categories. And it's not that a practice has to pass all 940 of those, but in the different categories, there are mandatory standards. The practice has to pass those in order to be accredited. And then there's a point total that they have to meet in each of those 18 categories. And so, a practice that's accredited, a client can rest assured that they have passed 18, in all 18 categories, they've accumulated enough points to become accredited.
And Dr. Cavanaugh says the 18 categories range from surgery to anesthesia to medical record keeping to equipment sterilization to even communicating with pet owners and everything in between. AAHA really covers all the bases so we can feel confident when taking our pets to the vet. So look for that red AAHA logo to be sure your veterinary hospital is going above and beyond for your pets. Personally, I settle for no less. I'm Steve Dale.